Accessing a subcutaneous port can occur in 4 easy steps: preparing, cleansing, inserting, and securing. Step 1. Preparing. First, you will palpate the port between the fingers and locate the septum, and using 2 identifiers, also 2 RNs, to assess if the port is a power port or a regular port will help you to determine the type and size of needle required to access a subcutaneous port. Your first step will be to don a mask. You should also offer your patient a mask as well. You will then open your PortaCath kit and create a sterile field. Then you will open a sterile, non-coring needle and place this in your sterile field as well. Next, you will don your sterile gloves. You will then remove the blue cap from the port needle and attach a CHG and silver impregnated caps. Then you will attach the 10 milliliter sterile 0.9% sodium chloride syringe to site cap and prime the port needle with 0.9% sodium chloride to clear air from your system, all while remaining in the sterile field. Step 2. Cleansing. Remove the chloropet found in the sterile field and clean the area surrounding the port site with a horizontal and vertical motion for 30 seconds until you've covered an area of 5 inches in all directions around the subcutaneous port area. Allow the area to air dry for about 30 seconds as well. Do not touch the skin during or after cleansing. You will then remove the port from the sterile field with your dominant hand and attach the biopatch to the Huber needle, all while remaining within the sterile field. Step 3. Inserting the PortaCath needle. Using your non-dominant hand, locate the port septum by palpation. This is usually the middle part of the subcutaneous port. Using your dominant hand, push the needle firmly through the center of the port until it hits the back of the port chamber. Part of the needle may be visible within the platform and the skin. Do not worry, it means you did a good job. With the dominant hand, flush 1 milliliter of 0.9% sodium chloride flush. You will then aspirate blood to validate needle placement by pulling back. If blood cannot be aspirated, you may need to reposition your patient by having them sit up or raise their arm. If blood still cannot be aspirated, you may need to notify a licensed independent practitioner to follow procedure for restoring patency of this device. Once blood has been confirmed aspiration, slowly inject the remainder of the 0.9 sodium chloride flush into the port clamp and then clamp the administration set, removing the syringe. You will note for any signs of extravasation with swelling or pain at site when this occurs. Step 4. Securing your device. After successfully inserting your PortaCath needle, you will need to remove the clip located on the top of the needle system. Before applying your dressing, make sure that your tubing is secured by placing it up towards the shoulder of the patient or down towards their chest using tape. You will then use the transparent dressing found inside the kit to cover the entire system, usually ranging as a tegaderm from 4x4 3/4 of an inch dressing. The dressing cap change is performed every 7 days. Congratulations, you successfully access a subcutaneous PortaCath device.